Today, we are covering quality improvement and patient safety, a critical area on the NCLEX because it tests your ability to think like a systems-level problem solver, not just a task-oriented nurse. The exam will give you a scenario, such as a repeated error in medication administration on your unit. The question will ask for your best action. The trap is choosing an answer that focuses on blaming an individual, like reporting a specific nurse. The correct answer will always involve a systems-level action, like using the Plan, Do, Study, Act, or PDSA cycle. For example, if the unit wants to trial a new handoff report sheet to reduce errors, the do phase of the cycle would be a small-scale test, like having 2 nurses use the new sheet for 1 shift. The exam will test if you can identify which action fits which phase. Remember that the goal is to improve the process, not punish people. When a major safety failure occurs, this is called a sentinel event. A sentinel event is an unexpected occurrence involving death or serious physical or psychological injury. Think patient suicide, wrong site surgery, or a medication error causing a patient's death. On the NCLEX, if you are presented with a sentinel event, your immediate priority is always the patient's physiological and psychological safety. After stabilizing the patient, you must report the event. Following a sentinel event, the hospital must conduct a root cause analysis, or RCA. This is the ultimate test of your systems thinking. An exam question might describe a patient fall that resulted in a hip fracture. The RCA team's goal is not to fire the nursing assistant who last checked on the patient. The goal is to figure out the systemic reasons the fall happened. A great mental shortcut for this is the 5 whys. Don't stop at the first answer. Why did the patient fall? The floor was wet. Why was it wet? A spill wasn't cleaned up. Why wasn't it cleaned up? The staff was overwhelmed. Why were they overwhelmed? The unit was understaffed. That is the root cause a quality improvement plan can actually fix. The NCLEX loves to test this non-punitive approach. To prevent these events from happening in the first place, the Joint Commission establishes national patient safety goals. The exam expects you to know these in a practical sense. When a question asks how to prevent a medication error, the answer will reflect a safety goal, such as labeling all medications, even those in a syringe. When asked about ensuring correct patient identity, the answer is always to use at least 2 identifiers, like name and date of birth. Finally, the exam measures your understanding of nurse-sensitive quality indicators. These are outcomes that are directly affected by the quality of nursing care. Examples include the rates of patient falls, hospital-acquired pressure injuries, and catheter-associated urinary tract infections. An exam question might ask you to identify the best measure of nursing quality on a unit. The correct answer will be one of these specific, measurable, nurse-sensitive indicators, not a general metric like patient satisfaction. Understanding this link between your direct actions and patient outcomes is essential for the test.